So today I have come with a very common question, which is a very widely asked question used in nursing. So it is all about grief today, a psychological subject also it can be asked, and in child health nursing also it can be asked, or any other sociology subject or any other subject which is relating to mental health or anything. The question can be repeatedly asked. So this question we will cover in detail with what is the definition of grief and also the types of grief and some of the stages which we are focusing on, especially pediatric. So let's start with the definition, that is, grief is defined as a psychological and physiological response of a person experiencing after the loss of a significant person, object or relationship. This was given by Craven and Harnell 2009. So here what it says is grief is a psychological or physiological response towards any loss. This loss can be of a person, object, or any relationship. So, in simple words, if we see, is grief is a multi-faceted response to loss, particularly to the loss of someone or something to which a bond was very formed and very close. Although conventionally focused on the emotional response to loss, it also have physical, cognitive, behavioral, social, and philosophical dimensions. So it has basically two dimensions, that is physiological and also psychological. So as we all know that commonly we say that psychology also have effect on our physiological health. In the same way, grief is a psychological phenomena, but it also have physiological dimensions. So what and all are the types of grief? So main type of grief is five, that is children's grief, and second is anticipatory grief, then normal grief which is uncomplicated, and the fourth is complicated grief, and fifth is disenfranchised grief. So first one is anticipatory grief. Anticipatory, from the word itself we can understand like we are predicting that some loss is going to happen. So anticipatory grief is grief before the loss, and actual or fear or potential of the loss is occurring. So it is experienced by the patient, or it can be by the family or by the professionals in our nursing industry, and also the children have unique needs during this kind of anticipatory grief. And next one is normal grief, which is not a complicated form of grief. It is just a normal feeling or behavior or reaction towards any loss. It can be physical, emotional, and cognitive and behavioral reaction towards the loss. Then we have complicated grief. So this is basically you're not able to identify if the person is in response to the grief. It can be a chronic grief for a long period of time, or a grief which is delayed grief, which was suppressed for a period of time but it was present but uh, was not remarkable, it was not showing. Okay, and then we have exaggerated grief, which is happening and then it is over and then again it is happening. That kind of grief is called exaggerated grief. So these all, if you notice, these are all complicated type of grief, so these are coming under complicated grief. And next we have masked grief, where we are not able to identify if the person is really undergoing something, so kind of mask face, if you have heard of the term. So that was all about the type of grief. And some of the risk factor if we see are sudden or traumatic death of any closed, then suicide or homicide experiences, then death of a child, or any multiple losses of object or financial or whatever it can be, that can cause a high risk of a patient to undergo with the problem grief. So next is disenfranchised grief. This occurs when loss cannot be openly acknowledged or socially sanctioned. For example, in the case of AIDS partners, and ex-spouse or step parents or child or terminated pregnancies, etc., which cannot be accepted socially, and but the grief is present, so that is called disenfranchised grief. Next one is children's grief. So based on the developmental stage, some of the children will have grief and lack of uh, psychological happiness, so that will cause a stage of grief in children. So we refer it as a unique symptom for the children causing child's grief. It can be normal or it can be complicated also. So the stages which we see in children's grief is disorganization, transition, and reorganization. So disorganization is the initial expression of the grief in children, range from regression, temper tantrum, lack of consciousness, and mood swings in the older children. So disorganization is like sudden reaction towards the grief. Okay, so here temper tantrum is like nothing but the action of getting angry towards the parents or towards sibling. So all those symptoms we will be seeing in this stage in a child. Then next one is transition. Feeling of hopelessness, helplessness, and despair follow stress, and chaotic behavior will be present in the patient. Then we have reorganization. When painful feelings are expressed, their emotional fades, and children feel better. And during this stage, children have more energy and motivation for moving forward to resolve the grief. So first one is nothing but disorganization. From the word itself, it says that there will be disorganized emotional control over the mind of the patient, where they will behave aggressive, temper tantrum, angry, then loss of consciousness, then getting mood swings and all that. And in transition there will be hopelessness, helplessness, like kind of calm situation will be there in transition phase of the grief. And lastly is reorganization, where all the feelings are getting fade away, and the patient, the child, will start feeling better and will start getting to the normal stage with the normal energy and motivation for moving forwards to resolve the grief. So some of the symptoms, if we see what and all are the symptoms of the grief, is physical signs and psychological sign and social sign. As I have already told you, there are all dimensions which are affected in the grief area. So differently we will see what is the psychological signs we see in the grief. That is psychologically we will see preoccupation or ambivalence towards lost object, and then anger behavior will be there, and fantasies that object is not lost. So all these things will occur in psychological changes. And our physiological change is insomnia. Changes is insomnia. Physiological is same thing. So it is insomnia, tight muscles of mainly chest or throat. Then loss of appetite and lethargy will be present. And in social signs, if we see, is withdrawal from the usual social activities, decreased work productivity, etc., will be noticed. So that was all about the grief. And if any further explanation you guys are needing, so you can do put in the comment, and I'll look after it and try to post that video as well. Thank you so much.